Ethiopia and Sudan are suffering deeply with violence, displacement and humanitarian crisis threatening the lives and future of millions. These conflicts not only devastate communities, but also hinder the continent's potential for peace, stability and development. 2 years of suffering, met with 2 years of indifference and inaction. The war in Sudan is a war on people, a reality that grows more evident by day, echoed by Christopher Lockyer, Secretary General of Medicine Sans Frontières, MSF, in his speech back in March 2025. I'm here to voice my profound concern about the situation of healthcare in Sudan, which has drastically worsened as a result of the continuous instability and conflict, disproportionately affecting women and children. An estimated 15 million people were compelled to escape to safety, either inside the country or across its borders, according to the World Health Organization, WHO, making Sudan the world's largest child displacement tragedy and one of the worst humanitarian crises in the 21st century. Today, more than 30.4 million people are in need of urgent humanitarian assistance, a stark reminder of the scale and depth of this catastrophe. Outbreak of preventable diseases such as diarrhea and cholera have been reported amongst displaced families forced to shelter in remote, hard-to-reach areas, a direct consequence of the absence of clean drinking water, proper sanitation and basic hygiene. As of August 2025, there have been over 300,000 cases, with as many as 4,478 deaths accounted for. Health facilities have been destroyed by aerial bombings carried out by the Sudanese army, resulting in 2/3 of hospitals to become inaccessible, forcing closure of 70 to 80 hospitals, with many wounded and unwell patients being forced to evacuate, leaving them to die. Many injuries and deaths remain unaccounted for due to the impossible access to hospitals, lack of transportations, and the security situation. There have been 51 confirmed attacks on medical facilities by WHO, cutting off complete access to urgent care. WHO documented an attack on Al-Rahma Hospital, West Kurdistan, in June 2025, killing more than 40 civilians, including children and healthcare workers, and this is not just an isolated case. In famine-stricken regions like Darfur, the Sudanese army has blocked efforts to provide medical aid, making it more difficult to distribute desperately needed aid. Medical professionals are struggling to treat undernourished children with limited resources, while vaccine-preventable diseases, including measles, diphtheria, is increasing as a result of interrupted immunization campaigns, increasing mortality rates. To date, more than 3.7 million children have been reported as malnourished. 2 years into the conflict, one must ask, what measures has the international community taken to address the humanitarian aid blockage? The situation is particularly dire for maternal and child health. Even before the conflict, Sudan had one of the highest maternal mortality rates globally. The conflict has significantly exacerbated these challenges, with hospitals being attacked or damaged, leading to a substantial reduction in emergency obstetrics and newborn care services. Pregnant women are often forced to give birth without inadequate medical assistance, increasing the risk of complications and fatalities for both mother and newborn, with more than 50,000 anticipated to give birth in the coming month without medical care. Mothers in Sudan continue to die from sepsis, eclampsia, malaria, and postpartum hemorrhage, conditions the world has long known to prevent and treat. Their death are not inevitable, they are a tragic consequence.
Sorry, I interrupt you, because we still have just 10 minutes, so if you allow us, then we can. So please conclude the
yeah. So, their death are inevitable, they're a tragic consequence of a health system and a crisis that denies women even the most basic care. In reports voiced from the south of Darfur, MSF shared the harrowing account of a mother who had buried 3 of her children, lives lost simply because she could not access the vital medications she needed during and after pregnancy. This is just one story among thousands of women across Sudan who face the same reality today. The birth of a child is intended to be one of the joyous moments in a mother's life. Instead, she was faced with the heartbreaking reality of having to bury her child. How does a mother find the strength to grieve and live? that's meant to be her greatest joy while grappling the fear that her other children may face the same fate. At the same time, sexual violence is being used as a weapon of war. Survivors are left without treatment, support or justice. Women are not losing healthcare, they're being deliberately targeted in their bodies and dignity. Many of these survivors were young girls and women, about 94%, somewhere as young as 5 years old. In addition to the burden of preventable diseases, civilians in Sudan have been subjected to chemical weapons by the Sudanese army, further exacerbating the health crisis. Victims have reported a range of severe symptoms, including skin lesions, respiratory diseases, contributing to significant loss of life and widespread suffering. This represents a new and alarming threat that the Sudanese population must now contend with. Sudan's health crisis extends beyond damaged hospitals. It reflects a collapse of protection, a violation of fundamental rights, and shattered lives. It needs to be recognised as a systemic assault on fundamental rights. It reflects not only a collapse of the medical system, but a collapse of international legal protection. However, the international community response has been inadequate thus far, with the promised aid failing to materialise effectively. Urgent international intervention is therefore imperative. Thank you.
Thank you. Thank you. Now we really have less than 10 minutes. Since